and that is it. Patients do have to wait until they're available because they're so sought after. So the hepatobiliary surgeon, the radiation oncology, the GI team, they have a multidisciplinary conference that helps everybody come up with a good plan for the patient. Should we resect it? Are they borderline resectable? Do we do a neoadjuvant therapy? Or is the patient in a metastatic case where we cannot help the patient and we have to just think of other measures to do? All these are studies, again, they go way into depth. These are all cancer drugs that I am not very familiar with on a day-to-day basis. I know of them, but I don't have the expertise to speak on them in depth. That being said, I will say also that gallbladder disease brings with it other issues. There's a lot of patients that come, not with pancreatic cancer, but with gallbladder disease. Disease of the canals, like the ones I showed you earlier, that's another disease that they can have a stricture. A lot of people that are older come in for some reason, and just like our arteries tend to harden, the canals tend to shrink, if you will, and they start to develop like a little stricture. Those can become malignant, so we take brushings and biopsies of those areas as well, and if they are malignant, then we go to the surgical teams to help us with that. I wanted to be pretty brief with this because I want to be able to ask if there's any questions that I can address briefly. Briefly, that's pancreatic cancer. I am familiar with upper GI, lower GI, GERD, all sorts of biliary tract disease. But does anyone have any questions on what I just spoke of? Yes?
When you have gallstones, they don't bother you, you still take them out?
Very good question. When you have gallstones, but they don't bother you, do you still have to have them taken out? Not necessarily. So many people can have gallstones and just live with them, and if they're not causing a problem, no, you don't necessarily have to have a cholecystectomy. There are many patients that say, I got diagnosed 10 years ago and they just started bothering me. So no, not necessarily. However, if you have pain, and this is something for you to know and to help your grandchildren, nieces, nephews, and the younger age population, I cannot tell you enough how important it is. If you have a female that's of childbearing age that can get pregnant, if you have or know a female of childbearing age that can get pregnant and she has problems with gallstones, have her take the gallbladder out. That's when someone should have a cholecystectomy in my eyes. Why? Because we have females, well, as a woman, when we're pregnant, everything changes. Hormones change, everything changes. And that's the time, we call it baby revenge sometimes, like a little saying we have, that everything goes crazy inside with hormones and everything's compressed up, and patients will come in with problems and pain here. But guess what? Now we have a problem because mommy's pregnant. Everything changes. We try our best to not have to do any intervention, any endoscopy or surgery on a mother that's expecting, because of course we have another life that we have to be careful with. So we had a case a couple of years ago. One of the members from one of our churches, actually, she presented. She was I've forgotten how far along she was, but she needed an ERCP. We made the very hard decision to go in and take care of it. By the grace of God, she did well, and her daughter was born well. And every time she sees me, she says, please, please tell that doctor that he saved my life and saved my baby's life. But it is not something we want to do. We only do it if we have to. But if a woman is of childbearing age and is having problems, have her take it out. Have her take it out. And you had a question?
Yeah, if you have gone in for the upper GI endoscopy, okay, would the CT scan have been done at the same time? Or do you have to specifically ask for the pancreatic CT scan?
Typically, no. If you have an upper endoscopy, say for GERD or whatever, no. Typically, CT scans aren't done. The primary care doctors someone will go in and say, doctor, I have this pain. Doctor will put the patient on a PPI or Nexium Protonics or Prilosec. They'll see that the patient fails the therapy and keeps on going in with the same pain or has some weight loss. I've heard talk about weight loss. Or has some weight loss, then we'll do an upper endoscopy, and that is it. Typically, no CT scans are done unless someone says, doctor, I have weight loss. I would say that 95 to 98% of patients that I see with pancreatic cancer say I've lost 20 to 30 pounds in 1 month. It's dramatic. It's a lot. It's very obvious. 40 pounds in 2 months. Just dramatic weight loss. That is not normal, and that has to be tended to. But by the time they're getting to that point, remember, they had a pain maybe 6 months ago, last year, and parents and grandparents tend to not tell their families because they don't want to bother them, or they think it's just going to go away. Bother us. Tell us. It's okay. Let us be bothered by that problem. Let us take you and have it checked out.
And then also, when you're having the upper GI done, is there an indicator to the doctor when he's doing that, performing that he could see that there's a problem with the pancreas?
Absolutely not. So when we do the upper endoscopy, the digestive tract essentially go into the esophagus, into the stomach. They look at the fundus, the body, the curvature, a little piece into the first part of the small intestine, the duodenum, and that's it. The pancreas is way deep inside. But of course, that's another reason that's how we diagnose gastric cancer. So that's another reason if you're having discomfort or pain, don't ignore it. It can be something in your stomach that we can take care of. And if you are having some pain, the Hmong population is very well known for this in our county, Southeast Asian population, to have H. pylori. And a lot of the Latino population, it must be our diet. Hmong population, Latino population, I don't know if it's our diet or our genetics or a combination of both. Helicobacter pylori is a bacteria that we get in our stomach that wreaks havoc and causes pain. H. pylori can progress if untreated to preliminary. They have studies that show that it can progress into some types of gastric malignancies. So, and that's easy to take care of. You take pills for 2 weeks, a bunch of pills for 2 weeks. They test you and it goes away. But being ignored, it can become a problem. Any other questions? Yes?
What advice do you have for us as to the role of diet and lifestyle in preventing these problems in the first place?
Absolutely. I have to say that the biggest indicator that I have seen in people with pancreatic cancer, because I take it on a personal mission when I see patients. Nothing bothers me the most than when I get a phone call, Lisa, I have a patient with a pancreatic mass. It's a so-and-so year old female or so-and-so year old male. I do ask them, and I try to, because I see so many on a daily basis for so many years, I've told myself, Lisa, try to find a common factor. Who knows, maybe you can come up with something that no one else has seen. One of the common factors is smoking. Smoking is heavy amongst patients that now have pancreatic cancer. They're in their 60s, 70s, late 50s, and I asked them, do you smoke? No. But then my next question is, did you ever smoke? And inevitably, I would say a lot of the times it's yes. 40 years ago. Well, how much did you smoke, sir? A pack a day. Well, for how long did you smoke, sir? For about 10, 15 years. So tobacco is very bad. The other thing is, I would say tobacco is something that I've seen that's common, but I can't pinpoint an ethnicity other than they're older. They're across the board. There's African American, white, Southeast Asian, Latino, but there was a time when I saw more Caucasian or Anglo people presenting. I think, to my recollection, I can only remember in the last 6 to 7 years for the patients that I've seen, I've only seen one male African American and one female that is of some type of Caribbean descent as well. But other than that, I have not seen very many African Americans present with this type of a problem. And I can remember him very well because there's so few. So it's more of a disease that I see presenting to the white population personally that I have seen. So smoking is a big indicator, and of course lifestyle for the gastric problems. It's the heavy, greasy, fatty, spicy meals that can tear away at the gastric lining of the mucosa, can cause problems, and not having a high fiber diet, because that can cause stagnation in the colon and it not moving, and accumulation of issues that can cause the colon to have problems. So lifestyle, just like they were saying earlier, not exercising, not eating healthy, smoking, All that, I think, takes part in the disease process. Anybody else? Yes?
What about a familial tendency? If you had a family member that had it, are you at a higher risk?
Thank you for asking. That's a great question. Actually, I have to say that I can say that approximately, just in my brain, maybe 30% of patients have a mother that has had breast cancer, or a father that had lung cancer. But cancer runs heavily in some families, and these patients don't present young, though. They still present in their late 40s and 50s. But yes, I would say about 30% of the patients that I see do have a family history of breast cancer, lung cancer, or hepatocellular or liver cancer. Yes, about 30% of patients do. So yes, there is a predilection for family history of cancer. Someone else had a question right here?
Yeah, my sister passed away when she was 69.
Oh, I'm sorry to hear.
And she had backache.
Oh,
And they kept telling her it was spinal arthritis. Arthritis in the spine.
people, I'm not an expert in all medicine. I've been in medicine for about 12 years. I've never seen someone die from that type of a situation. I did neurosurgery for a year where we had to do with the spine. And did they work her up for that? And did they do a CT scan on her? Do you know if she got a CT
I
scan?
don't know. She lived in San Diego.
Oh, yes. Sometimes talking about metastatic cancers, a lot of the diseases spread to the spine. So that causes back pain. In a person that's older that has never had back pain, usually active, all of a sudden has back pain, that's something to be concerned about. Yes, absolutely. Yeah. And she passed at what age, you say? 70. Any other family history of issues in your family? Any cancers in your family?
Well, my father died from that also.
From pancreatic cancer. Oh, okay. And so my advice would be, if someone passed of an unknown disease and father passed of pancreatic cancer, I would just be very watchful of your brothers and sisters.
Her son also died from that.
Whose son?
My sister that passed away from that.
Her son passed as well. Okay. So yeah, also if there's a heavy history of cancer in your family, I would also ask my primary care doctor to send me to a genetics physician, a geneticist. They can do the family tree and they'll ask you all kinds of questions. And actually at the multidisciplinary conferences, I've been there, they have geneticists that are there and they do the tree and they talk about the probabilities. And that's how they help the family members of the people that are diagnosed with cancers, so they can try to avoid them or try to target them early. Yes.
Do we have one of those genetics here in Fresno?
Do we have what?
One of those doctors here in Fresno?
A geneticist? Oh, absolutely. To get to those doctors, your primary care doctor would probably say, who have you been talking to? Why are you asking that question? That's what they asked me to go off on a tangent. When I was Catholic, I was raised Catholic, and deviate for 5 seconds. And I was looking for truth. I don't know how many of you met Dr. Springle before he passed. He is one of the people that brought me to Jesus. And I asked one of the priests at UMC back then. It was heavy on me. It was a burden, and I went to him and I said, so I'm a Catholic and we always go to church on Sunday. Where is that in the Bible? And the first thing he said to us, who have you been talking to? So that's what I said. He'll probably say to you, who have you been talking to? But yes, there are geneticists here in Fresno. Anybody else? Any other questions? Yes.
I've been taught that the pancreas makes enzymes, is that correct?
It has some pancreatic enzyme, yes, creation.
So I was taught to let the pancreas rest
Yes.
by supplementation. So you can eat pineapple or papaya or supplement with enzymes that are the tablet.
Okay, that I'm not familiar with, I apologize. People that have pancreatic insufficiency should see a GI doctor that's familiar with that, an advanced GI doctor that can focus on that, and they can prescribe replacement enzymes. But hey, anyone here had pancreatitis before? That's great, that's very good. I'm happy to hear that. Someone talked about lifestyle. The pancreas can be insulted with alcohol. If someone binge drinks with alcohol and they get pancreatitis, they'll never forget it the rest of their life, I guarantee you that. But once there's an insult to a person that drinks heavy alcohol and they get pancreatitis once, they're more susceptible to get pancreatitis again. And that can cause pancreatic insufficiency, what she's speaking of. That can be a long-term problem.
Now, will that come back each time they binge drink? Or
I
will
hope
just-
it does, because that can save them from
Or will
having...
it just come back?
I've had patients from every spectrum, heavy alcoholics, thinking that a pint of vodka a day is normal for 5 years, and then all of a sudden they come in and their pancreas is shot, and I say don't drink, and they say okay, they disappear for 2 to 3 years, and then they reappear 4 years later, and I say, haven't I met you before? Well, yes, I just took a sip, and I hadn't drank for 4 years, and I just took a sip. And that's all it took. And I say, sir, don't drink it, don't smoke it, don't inhale it, don't dream it. If you see it at the store, walk around the other aisle, go around it. Don't even think about it, because that's the only way you can stay away from it. So yes, it does come back. And everyone's different.
But what I'm asking though, does it only come back when they drink, or does it just come back on its
It
own?
can come back with or without. I've seen patients that have one insult, and then something else may trigger it, maybe a heavy fatty meal, or having gallstones. It can be triggered by other things, absolutely. Or it can come on its own. They say, I haven't drank, and I haven't drank, I promise you I haven't drank, and it has come back. It just varies. I tell everybody, the pancreas is the president. If you have pancreatitis, it tells us what to do. We don't tell it what to do. The pancreas is very finicky.
What about diabetes?
And the pancreas? People that have diabetes in their families or have pancreatic insufficiency that have diabetes, usually the pancreas is a very forgiving organ. If someone has diabetes, it may be underproducing, but with medication it can be fixed. Insulin is given to people that don't have a pancreas that's fully functioning as well as it can be. So the spectrum of diabetes is wide. That's a whole different conversation topic that I could talk about any day you like, but the pancreas can be seen as minimally producing, overproducing, or not producing at all. And that's what comes with diabetes. It's just a spectrum.
Lisa, this is kind of off the topic, and I think you should really share your testimony from the beginning to the end. I mean, these people would really like to hear that sometime.
Oh, absolutely. I'd love to. I would be honored to come and share my testimony anytime that I would be invited. My family is back here. I have my son, Guillermo. He's a graduate of Andrews. And then Lisette, my daughter, she attended Union and is here doing nursing, and Hadassah's at the academy. But we're fortunate that you have known us. She and Mrs. Wiest, when I was expecting of Hadassah, they gave me my first baby shower gift. They invited me to a restaurant and they gave me a gift. I still have it. So they saw me when I was expecting of Hadassah, so we go way back.
And
But yes,
I
I'd love
was
to.
the first person you told that you were going to have a baby.